Wyoming by Research and Planning, as I said. Please also leave your name and who you're watching with, where you're from, in the chat box. It's best to use the chat box to ask questions during the presentation, but it is okay if you would prefer to unmute yourself and just ask at the appropriate time. I ask for questions throughout the presentation, and I'm really excited to have so many different people on here who are invested in this topic. So, my name is Caitlin Failer. I'm going to be your guide as we wade through all of this information. I'm a senior economist at Research and Planning, part of the Department of Workforce Services, and our office is in Casper. I've been at Research and Planning for 4 years, and in college I studied economics and geology, and I started my career in uranium mining, but here I am. And I'm curious about everything, and for me, fun is making complicated data more easily accessible to busy people. So call me a nerd, say what you want, but at least I enjoy my job. At Research and Planning, we just do the numbers. We're exclusively a statistical agency. We don't run any programs out of our office. Our funding isn't tied up in how well a program works, so we can more honestly evaluate it. And a lot of our funding is federal. We use surveys and administrative data to do most of our research, and administrative data is considered the gold standard of data collection. I'm here to help you get the information you need to make the best decision for you and your business. And I'm always up for a challenge, so if you think your question is too hard, I hope you'll ask. We have 5 big questions for today, and our first is what is a nursing assistant and how are they counted? Some jobs may have the same job title, but completely different responsibilities. We're going to make sure that we're comparing apples to apples and go over some definitions first. And so our next question is, how does Wyoming compare to other states and the nation? Could Wyoming lose nursing assistants to other states because they pay more? Have wages for nursing assistants changed over time nationally and statewide? Third, within Wyoming, how do regions and industries stack up? Not all nursing assistants work in the healthcare industry, and this is especially true in Wyoming. How are wages different? How are nursing assistants more experienced in some regions of the state than others? And is employee turnover different in each region? Then we'll move on to talk about nursing assistants' risks and benefits. And by risks, I literally mean the risks that nursing assistants face every day in terms of injuries, and the benefits, like healthcare, retirement, dependent healthcare, that they are likely to receive based on where they work. Finally, we'll talk about what are the factors influencing the availability of nursing assistants in Wyoming. What are some major factors that could be influencing healthcare employment overall? And what job openings are predicted for nursing assistants in the next 2 years? Many of the answers to these questions may not surprise you, and that's good. That means you're observant and you know what's going on in your business. But some of the answers to these questions may seem totally out of left field, and this is also good. Surprising data can help us look at our observational blind spots and take on the bigger picture. Or it can force us to dig deeper and ask why. Along those same lines, what I've done here is I've taken raw data and I've tried to make it understandable and tell a little bit of a story with it. I don't work in healthcare and I never have, which means I personally have blind spots of my own and blind spots that I am not aware of. If you notice something obvious to you that I have overlooked, please share it with all of us. I want to hear it. It makes me a better researcher, and it will allow us to discuss new aspects of the data that I could not have brought up without your input. So, as promised, we first need to get our feet under us, and let's talk about some definitions and about how a good chunk of the data for this presentation was collected. The very first definitions we need to talk about are the differences between occupation and industry. To sum it up, an occupation is how you make money, and an industry is how your company makes money. For example, someone who works as a welder, who has the occupation of a welder, who makes money by joining together two pieces of metal. A welder may work for many different types of companies, and the company may make money as a refinery in the oil and gas industry, in the construction industry, as a nuclear power generator, or in the manufacturing industry. And wages are often different in each industry. A lot of the data in this presentation comes from the Occupational Employment Statistics Program. It's a survey, and it's a survey conducted by the Bureau of Labor Statistics and state offices like my office, Research and Planning. We gather information from businesses about what jobs their employees are doing and how much they are being paid. All of this information that comes from the OES is an estimate. And why? Because unlike other programs, the Occupational Employment Statistics Program is a survey, and a survey takes answers from a few and estimates what everyone else would answer. It's a very well done survey. It's not a Facebook survey. It's not a survey that asks 50 undergraduate men what they think and then makes sweeping psychological assumptions about human behavior. Because it's a survey and not a census, the Occupational Employment Statistics Program doesn't have to ask all 7.6 million possible businesses in the US who they're employing and how much they're paying everyone every 6 months. They save us all a lot of money and time by asking about 200,000 different establishments for information biannually. Basically, around 3% of non farm, non military businesses are surveyed every 6 months, and a business can't be surveyed more than once every 3 years. In order to make OES the good survey that it is, one that is relevant to the entire country and its territories, you can't just put all 7.6 million businesses into a hat and draw out 3% of them at random. If we did that, we'd probably end up mostly only surveying financial and real estate businesses in California, and I'm not sure if you've noticed, but Wyoming is not California. To make sure that doesn't happen, each of the possible businesses that can be surveyed are grouped by geography, industry, size, and whether the employer is a private company or part of the government, like schools. When this is done, instead of one big hat to draw from, there are around 158,000 small pools to choose from. And the survey is done so that there is adequate representation from each of these pools, so that wages from occupations common in San Francisco and New York don't wind up representing us. While the Occupational Employment Statistics Survey asks about 200,000 businesses what's up every 6 months, not every company responds. Depending on how you slice it, the response rate for the OES survey was around 70% for May 2017. The data that are released each May include a compilation of responses. The most recent survey is from May 2017. It was released just a few months ago. The May 2017 survey includes responses from May 2017 and the 5 previous surveys dating back to November 2014. Data collection for this year, May 2018, has just begun. So the OES collects so much information, and many people prefer to zoom in on average annual wages for each occupation. Personally, though, I prefer to look at hourly wages by percentile when I look at OES data. First, I prefer the hourly wage to the annual wage reported in the Occupational Employment Statistics Program because OES assumes that everyone working in an occupation works full time, which is increasingly not representative of our economy. Many people work multiple part time jobs. You may have heard the expression the gig economy. Second, I prefer wages by percentile to average because the average can at times be quite a bit higher than the median or the 50th percentile. Also, since the survey doesn't, as we are so often asked, break out pay by years of experience or level like CNA 1, 2, or 3, sometimes the 10th, 25th, 75th, 90th percentiles can be used as estimates in place of level or years of experience. In this presentation, I use median hourly wage whenever it is available. Or questions? Okay. Shout out if at any point there are questions. The Occupational Employment Statistics Program knows that each business categorizes their employees slightly differently, which can make getting unified information pretty challenging. That's why they use the Standard Occupational Classification Codes, or the SOC codes. Standard Occupational Classification Codes define and codify occupations in the public, private, and military sectors of the US economy. It is set up in a hierarchy that is updated every few years. Nursing assistants fall under 31, healthcare support occupations. I've put part of the nursing assistant definition up here. The definition goes on to list examples of job titles that nursing assistants may have depending on the company they work for, which may include certified nurse aide, certified nursing assistant, nursing care attendant, things of that nature. In this presentation, I try to say nursing assistant when I am talking about the occupation, and CNA when I am talking about the people licensed in Wyoming, and CNA standing obviously for certified nursing assistant. Questions? Okay, well, we've made it through the groundwork so far. Let's get on to the important stuff. How does Wyoming compare to other states and the nation? Some basic info about nursing assistants in Wyoming. Usually, there have been about 5,000 to 6,000 people with certified nursing assistant licenses in Wyoming each year since 2002. This count excludes people who may also hold another medical license, such as a registered nurse. This number, 5,000 to 6,000 people, is the number of people who have only had a CNA license. An average of about 4,700 licensed CNAs work in Wyoming each year. That means at any point, about 15% of licensed CNAs are not working in Wyoming. They may have a license in Wyoming, but they may not even live here. Not everyone who is licensed as a CNA works as a nursing assistant. Some people work in retail or at restaurants, and they're probably not using their license. As we'll see later, depending on how you slice the data, probably about 4,100 CNAs work in the field where they are likely using their license in Wyoming. The median hourly wage for nursing assistants in Wyoming in 2017 was just over $14 an hour, according to the Occupational Employment Statistics Program. And consistently, about 93% of licensed CNAs have been female. Just for Wyoming. I'm not sure about other states. Probably similar. Questions? Let's take a look at how hourly median wages have changed over time. These wages are for all industries, not just healthcare. We'll use this graph with the dollars going up and down and the years from 2004 going left to right. We'll compare nursing assistant wages to wages for all occupations and wages for Wyoming to those of the US of A. It's really important to make comparisons and not just throw out statistics and percentages like it's political dodgeball. For example, I can't just say wages for nursing assistants in Wyoming have gone up almost 50% since 2004. Well, in fact, wages for nursing assistants in Wyoming have risen almost 50% since 2004, from a little over $9.50 per hour to just over $14 per hour. But when you put this in perspective of wage changes for all occupations in Wyoming, it's normal. Wages in Wyoming have also gone up about 50%. Context is important, and judging by this graph, so is inflation. Another important thing to note here is that median hourly wages for nursing assistants in Wyoming are quite a bit less than wages overall. Hi, are you just joining us? No, okay. Would you, again, if everybody could mute their phone if you're not speaking, that would be awesome. Makes everybody's experience more enjoyable. Adding more context, let's throw in a comparison to the national median hourly wages. In 2017, national median hourly wages were $18.12 an hour for the national median hourly wage for all occupations, and that's compared to $18.81 for Wyoming. For nursing assistants, wages in Wyoming surpassed national levels between 2007 and 2008 during a big boom in Wyoming. Median hourly wages for nursing assistants nationally are about 20 cents lower than in Wyoming. A big thing to note here are the changes that have happened over time. Nationally, since 2004, median hourly wages have gone up about 30% for all occupations and for nursing assistants, but wages have gone up almost 50% in Wyoming. As I said, these wages are for all industries, not just healthcare. Nationally, 92% of nursing assistants work in healthcare, but in Wyoming, only 80% of nursing assistants work in healthcare, and a good chunk of the remaining 20% work in administration of public health programs, where their wages are higher. As may or may not be surprising, for Wyoming and surrounding states, generally, the greater the ratio of nursing assistants who work in healthcare throughout the state, the lower the median wage was in 2017. Questions? Let's look then. If there's no questions, let's go ahead and look at wages comparing Wyoming to surrounding states. Are median hourly wages across all industries for nursing assistants in Wyoming competitive with surrounding states? Generally, yes. At about $14 an hour, the only state that has a higher median hourly wage across all industries is Colorado. I'm not sure if you've heard, but Colorado is expensive compared to Wyoming. However, there are travel reviews about Denver left by people visiting from California talking about how affordable it is in Colorado. Like I said, context is important. At $13 an hour, Nebraska is the next closest state. Median hourly wages are lowest in South Dakota out of Wyoming's border states. Are there questions? If you do have questions, type it in the chat bar or chime in by unmuting your microphone. So let's do a deep dive into nursing assistants within Wyoming. There are hundreds of classifications for industries, but we're going to focus on the industries most relevant to nursing assistants: healthcare and government. Specifically, within healthcare, we'll focus on, quote, ambulatory care, which we're going to call outpatient care, which is mostly made up of doctors' offices. We'll also focus on hospitals and nursing and residential care facilities, which we'll call residential care. Within government, we'll specifically look at administration of public health programs or public health. What's the average CNA like in Wyoming? Well, they're female, most likely, as I said before. They're in their early 30s, and they've had their license for 3 to 4 years. In Wyoming, they're most likely to work in healthcare. And if the nursing assistant works in healthcare, the 2017 Occupational Employment Statistics Program estimates their median hourly wages at $31.91. If they're a newly hired CNA, meaning not that they've never worked as a nursing assistant before, but that they've never worked for that company before, then they're hired to work about 30 hours per week. Just like we looked at median hourly wages for nursing assistants across all industries for Wyoming as a whole and surrounding states, let's look at how median hourly wages differ regionally within Wyoming for nursing assistants across all industries. The Occupational Employment Statistics Program divides Wyoming into these regions. Casper, or Natrona County, and Cheyenne, or Laramie County, are considered metropolitan areas, and the remainder are considered non-metropolitan areas. Do we just have somebody else joining us? Welcome, Callie. I'm glad you could join us. Right now, we're just talking about median hourly wages for nursing assistants in different regions of Wyoming based on the Occupational Employment Statistics Survey. So, as I said, there's Casper and Cheyenne. Those are metropolitan areas. And then there's the non-metropolitan areas, the southwest Wyoming non-metropolitan area, the northwest, the northeast, and the central southeast. Check out these wages, recalling that the median hourly wage for nursing assistants is just over $14 an hour. Cheyenne has the highest median hourly wages for nursing assistants. This hourly wage may be driven up by competition along the Front Range. But as we'll see later in another data set, while the Occupational Employment Statistics Program estimates Cheyenne's hourly wage to be the highest in the state, nursing assistants in Cheyenne are generally younger and are not likely to be making the most overall. The second highest median hourly wage for nursing assistants are in the Northeast, followed by the Northwest, and the Southwest, both at $13.96 per hour. Then Casper. Finally, nursing assistants in the Central Southeast region make the least. Remember, these wages are across all industries, not just healthcare. Recall how the Occupational Employment Statistics Program divides businesses into pools by industry and region. Well, some of these pools in Wyoming can get quite small, and it makes it harder to make a good estimate of hourly wages by industry. So for the next couple slides, we won't be using occupational employment statistics data, but data from wage records. Wage records doesn't keep track of the number of hours worked. So we're going to look at median annual wages for 2016. This table focuses on outpatient care, hospitals, residential care, and public health. The ratio of licensed CNAs in Wyoming working in each of these industries has not changed too much since 2002, except that the number of CNAs working in public health has declined by about 40%. The number of CNAs working in residential care has almost always been close to, but slightly more than the number of CNAs working in hospitals statewide. For those of you who are much quicker with arithmetic than I am, you'll notice that while I said earlier about 4,700 CNAs work in Wyoming each year, the numbers here add up to 4,188. Many of those not accounted for here work in retail and in restaurants. They're generally the youngest CNAs, and it's pretty unlikely that they're using their license in those industries. CNAs in outpatient care and residential care are usually younger and less experienced than people who work in hospitals, and especially younger than CNAs who are working in public health. Most of the time, over the past 15 years, the median age of CNAs in public health has been a solid 12 years more than median age of CNAs in outpatient care and residential care. And as we'll see, for CNAs, experience pays. In 2016, median annual wages in hospitals were $23,407. $407 with a median experience of just under 4 years. And CNAs in public health had a median experience of 7 years and made about $32,000 per year. This is probably due to a number of factors. Experience can allow CNAs to change work environments, get more favorable hours or more reliable hours, and unpaid care obligations also probably play a large factor in median wage. Younger CNAs tend to be of a demographic that bears the brunt of unpaid family caregiving responsibilities. The median wages vary from region to region within the state, but almost across the board, outpatient care and residential care make the least, then CNAs in hospitals, then public health. As I said, I typically prefer hourly to annual wages because it makes it a better apples to apples comparison. But wage records does not collect information on the number of hours worked, and annual wages are important too. They can indicate whether or not a household will be self sufficient. Are there questions? Does anyone find this information surprising? Is this what you expected? I'd love to hear because, as I said before, I don't work in healthcare. I sit behind a computer and try and make judgments. So, if anybody has any input on this, I would love to hear it. I think we've had some people join us recently, and if you could, please type in the chat box who you are and who you're watching with, where you're from. Really helps with my record keeping, and also we have quite a bit of people here from Rock Springs and other people from Thermopolis and Gillette. It's really good to be able to make connections in our rural state. If there are no questions, let's look at median annual wages for CNAs by region in Wyoming. Recall our regional map. Now check out the median annual wages for people who have a certified nursing assistant's license in Wyoming and worked in healthcare or in government. Median annual wages are lowest for CNAs in the central southeast region, followed by Cheyenne. In these two areas, CNAs are younger and slightly less experienced. They're typically in their late 20s compared to the rest of the state, early 30s. CNAs in Casper and the Northeast region earn similar median annual wages, while CNAs in the Southwest and the Northwest earn more annually. Differences in wages may have a lot to do with the type of healthcare work CNAs do. For example, in Casper, the Central Southeast, and in Cheyenne, residential care is a bigger industry than hospitals, and generally, CNAs in residential care make less than CNAs in hospitals. In the rest of the state, hospitals employ much more or about as much as residential care facilities. In the Southwest region, public health is a large employer of CNAs. 62% of CNAs in the state who work in public health are employed in the Southwest region. This may be related to the state hospital, and it may contribute to the relatively higher median annual wages for CNAs in the western part of the state. Thanks, Callie. Thanks, Yvonne. Thanks, Jenny. I'm glad that you guys could join us from Cody, Casper, and Jackson, respectively. I'm really happy you're here. And what do you guys think? Is this surprising to you? Does this follow what you know? Is this related to what you know about healthcare in your area, what you know about government in your area? Chime in at any point. It would be great. Okay, let's continue. In this table, you can see the type of healthcare going up and down, and then the name of the region going across the top. CNAs who work in outpatient care typically have lower median annual wages. There could be many reasons for this. Fewer hours and less shift work come to mind. In doctor's office, a CNA may work an 8-hour day, but shifts in hospitals and residential care facilities are typically 12-hour shifts. And sometimes CNAs are paid more for less favorable shifts. Hospitals pay a lot more than outpatient care, but usually still less than public health. CNAs in hospitals in Cheyenne earn a median annual wage of almost $26,500 per year. That's that's the highest median in the state. Residential care pays more than outpatient care and less than hospitals almost across the board, with the highest median annual wages in the northern parts of the state for residential care. The statewide median for licensed CNAs working in public health is about $32,000 per year, and it's much lower in Casper. And for the Central Southeast region, this information is confidential or non-disclosable due to privacy reasons. So what do you guys think? Does this line up with what you know? Are there discrepancies? What is surprising to you? Maybe what is totally not surprising to you? Would love to hear. Use the chat box at any point. So a big cost to businesses is employee turnover. And we're going to look at a graph on employee turnover. Callie asked, what category does AL fall under? AL, are you meaning Albany County? Assisted living. Assisted living is under residential care. Thank you. See, this is, I'm very clearly not in healthcare. I'm glad that you educate me on those acronyms. Yvonne says that some of the clients I work with are getting a lot of hours for home health. So is there a lot of opportunity? So there's a lot of opportunity for overtime. Yeah, Yvonne, we don't actually go into home health in this. We like specifically businesses that specialize in home healthcare. Maybe they do some outreach through public health, but for home healthcare, we don't really cover that in this. But it is actually something that the Occupational Employment Statistics program, where I've gotten a lot of this data, they've only just started counting that. They previously did not count people as working in private homes, as they just weren't counted under this survey. So it's really a big deal because a lot of nursing assistants do home health care. Thank you for sharing that. I did not know that about home health. Okay, moving on to CNA turnover, or we can go back if other people have questions, just type them in the chat box. At Research and Planning, we measure turnover, or who changed jobs, by percent. Someone is classified as continuously employed if they did not start or stop working for a particular business during that quarter. If someone enters the labor force or changes jobs or quits their job in a quarter, they are not continuously employed during that quarter and are counted towards the turnover rate. Overall, Overall, in the Wyoming economy for all jobs, not just CNAs, about 1 in 5 people got a job, quit, or changed jobs. Statewide, CNAs had a turnover rate about the same as for all workers in Wyoming, close to 20%. Generally, turnover is higher among younger people, and this makes sense. Like, think summer jobs, more limited soft skills, more mobility, fewer dependents. This extends to what we know about CNAs. Remember, younger, less experienced people working in outpatient care and residential care, um, they're they're younger. Turnover for people working in these industries with a CNA license was close to 30%, much higher than the statewide average for all workers and much higher than the statewide average for CNAs. As CNAs gain more experience as they mature, they often move into a hospital setting where turnover for CNAs is just below the statewide average. In administration of public health programs, however, turnover was below 10% in 2016. These turnover statistics are not meaningfully different from region to region in Wyoming or over time, barring major things like hospital closings or residential facility shutdowns. Turnover tells us a few things. It tells us about which jobs people prefer to work and where they prefer to work as they mature, which industries are probably spending a lot in HR recruitment costs. So, questions? Okay. In this section, I use data from the Survey of Non-Fatal Occupational Illnesses and Injuries, our Benefits Survey, and our New Hire Survey. We'll first talk about injury data at the national level, comparing nursing assistants to all occupations. Nationally, nursing assistants are injured at more than 3 times the rate of all occupations. When the injury results in days away from work, the median number of days away from work in Wyoming was about 6 in 2016. Nursing assistants are more than 7 times more likely to have been injured through violence or by a person or animal through violence by a person or animal while working than average. And this includes dog bites. As Yvonne points out, many CNAs make home visits. They're more than twice as likely to suffer a slip, trip, and fall, and almost 6 times more likely to be exposed to overexertion, with overexertion being the most common reason for an injury to a nursing assistant. The most common type of injury for nursing assistants is a sprain, strain, or tear, and nursing assistants are almost 5 times as likely to suffer a sprain, strain, or tear. A back injury is the most common location for a nursing assistant to be injured, and they are almost 7 times as likely to suffer a back injury as the average worker. They're more than twice as likely to be injured in some part of their head, almost 4 times more likely to suffer a shoulder injury, and about 4.5 times more likely to suffer a wrist injury. Healthcare patients injure their caregivers often. About 5.2 in every 10,000 full-time workers doing any type of work are injured by a healthcare patient. Nursing assistants are about 34 times as likely to be injured by a healthcare patient than average. Does anyone find this information surprising? Yesterday, some people found the magnitudes quite surprising. Okay, we'll continue. Yeah, Jenny says 34 times as likely is so high. And yeah, that's even including like all occupations. So like if we took the whole United States as an economy, it's like even like HR workers who work in like a healthcare facility, like perhaps they're injured by like a patient suffering from dementia by mistake. Like even this includes like people who aren't even giving direct care, and the rate for people in general is very high, and then the rate for nursing assistants is also very high. I haven't yet compared nursing assistant rates of injuries to those of nurses and doctors or LPNs, but I would imagine that nursing assistants are probably the most likely to be injured because they are on the front lines of people providing care. Okay, to continue. When we compare incidence rates by Wyoming industry, not by occupation as we've just been doing, but by industry in Wyoming, non-fatal injury rates for the industries where CNAs are most likely to work are even higher than construction. This graph shows the incidence rate for an injury or illness for private companies in Wyoming in 2016. And the incidence rate is the number of people who are injured for every 100 full time workers. The number of people injured for every 100 full time workers. It's not exactly a percent because businesses typically employ full time and part time staff. Overall, for all private companies in Wyoming in 2016, the incidence rate was 3.4 in 100 full-time workers, or slightly higher than and it was slightly higher than in retail. The non-fatal incidence rate for the construction industry was 4.5, much lower than private hospitals and residential care facilities. Workers in residential care facilities were almost twice as likely to be injured as a construction worker. In this case, I do want to stress that this is a count of non-fatal injuries and does not indicate the severity of an injury, only that it was a recordable incident. While workers in hospitals and residential care may be badly hurt on the job, typically, healthcare doesn't have as many fatalities as, say, construction. And if we examined fatalities, this graph would look quite a bit different. So context, again, context is important. Any questions? Any thoughts? Anything surprising? Anything totally expected? Okay, well, we've talked about nursing assistants' risks. Let's talk about the benefits that Wyoming employers offer. Overall, larger employers are more likely to offer benefits than smaller employers, and employers in Cheyenne and Casper may be slightly more likely to offer some benefits than businesses in non-metropolitan areas. This may still be related to the size of a business, as businesses may be bigger in more populated areas. This table compares state, local, and government employers, healthcare and social assistance employers, retail employers, and employers statewide, based on how often they offer health insurance, dependent health insurance, and a retirement plan. Statewide, 30% of employers offer health insurance. Retail employers offer the statewide average, but somewhat surprisingly, employers in healthcare and social assistance are less likely to offer healthcare. Healthcare and social assistance employers are also less likely to offer dependent health insurance. Again, a greater percentage of retail employers offer dependent health insurance than healthcare and social assistance employers. However, healthcare and social assistance employers are more likely to offer some kind of retirement plan than the average employer. Most government employers offer health insurance, dependent health insurance, and a retirement plan. This table shows employers who offer benefits by industry, but not which occupations are more likely to be offered benefits. However, some rough unofficial estimates from our new hires survey lead me to believe that about 1 in 5 CNAs hired for full-time work are not offered any benefits. For newly hired part-time CNAs, about 2 in 3 are not offered any benefits. And remember, the median number of hours a newly hired CNA is often hired to work in Wyoming is about 30 hours per week. And most of the time, that's classified as part-time. Some facilities classify it as full-time. Janet Bolin says that it makes that some of this information makes her hesitant to suggest CNA as an occupation. I think, yeah, other people have also said that too, and it makes my job seem pretty cush. Not that it isn't, but it makes like I don't have the same risks that CNAs face every time. On a day-to-day basis. I think as CNAs do training and as uh, businesses run their business, like encouraging safety as a policy, a top-down policy and a bottom-up policy, like that's really important, I think, because those numbers of those injury rates are just so high. Thoughts on this graph? Thoughts on anything else so far in this presentation? I always find this really interesting that healthcare and social assistance employers are just less likely to offer healthcare insurance and dependent healthcare insurance. I think possibly that speaks to them knowing so much the cost of providing those benefits. So, and that's just my theory. Okay. So what's next for nursing assistants in Wyoming? What is driving employment? What I hear most often from people working in healthcare is that the patient census drives employment. We don't have any patient census data at research and planning, but patient census is related to population, and Wyoming's population is definitely related to the number of people working in Wyoming. So let's look at this graph. Oh, Yvonne says there is a big need for CNAs, but the benefits aren't very appealing and it's hard work. Uh, yeah, I hear that anecdotally from a lot of my friends, and you know, I, I think like the benefit, like the pay and the benefits, kind of speak to how we value that occupation, and a lot of times like how we value our elders um, in the U.S. is that maybe it does or does not speak to that, and maybe the discrepancy is something that we need to look at as a society. It's very interesting. The need for CNAs is so high, but the way they're compensated does not seem um, attractive to attract people to that occupation as a long-term occupation. Do feel free to disagree with me on that. I'm definitely open to hearing evidence. So, but let's take a look at this graph. This graph shows the number of people working in Wyoming each quarter, going up and down on the left. And the teal line shows us how seasonal Wyoming's employment is overall, peaking each summer for construction and tourist season. And we all know what tourist season looks like in Wyoming. So, Wyoming's employment is very seasonal, but healthcare employment, as measured on the right side of the graph, is not seasonal. It's antithesis of seasonal. Healthcare employment definitely accelerates during boom times in Wyoming, but it's pretty stable. Some parts of healthcare react more to downturns than other parts of healthcare. Darla Parks just added higher incidence rate of injury in first year CNAs versus experienced CNAs. Darla, I really wish I had that information. I will talk with maybe Chris. Chris, do you know? Chris is she's on this call, and she does our SOI survey of occupational illnesses and industries. And I'm not sure that that's broken out by the incidence rate is broken out by how many years that person has been working at a different place. I'm not sure that information is even collected. Chris, if you know, feel free to type and chime in. Otherwise, Darla, I will get back to you. But I don't think that information is collected. I think there could be two conflicting factors is that often CNAs who are in their first year are younger and perhaps more physically fit and less likely to overexert themselves. Yeah, I don't know for sure. It's a hypothetical. Um, but they also might, tend to overestimate their own strength and their own ability. So, yeah, I wish we could break that out. I think perhaps there may be some other professional organizations that have done that. Chris says, I may be able to search by years of service to answer her question. It is asked in the survey. Okay, so Darla, no promises, but we will see what we can do. Thanks so much, Chris. So, back to talking about employment in Wyoming, which is very seasonal, in healthcare, which is very not seasonal, and the fact that in different parts of healthcare, you can see economic ups and downs in Wyoming. This graph shows us employment by different types of healthcare. Hospitals employ the most people in Wyoming within healthcare, followed by outpatient care. And you can see in outpatient care employment has flattened out since 2015, and it hasn't really changed since 2015. It's easiest to see the economic downturns in residential care employment. And residential care employs large numbers of nursing assistants. Look at the red line at the bottom of this graph representing residential care. Follow it to the years 2009 and 2015. These dips coincide with labor force losses and higher unemployment. There are other ups and downs outside of residential care. but these are not as big. And they're definitely not big seasonal swings as we saw in the previous slide. However, changes in healthcare employment get a lot of news coverage, and these changes are unusual and often represent losses of stable, high-paying jobs. Out of everyone in healthcare, I would take a solid guess that employment for nursing assistants on the front lines of patient care depends more on patient census than other occupations, and that nursing assistant employment reacts more quickly during booms and busts than other healthcare occupations. And who leaves during downturns? Usually, it's younger people with more mobility and fewer ties to the state. This may include CNAs sometimes, as CNAs are typically younger. You may have heard or read a news article in the Casper Star Tribune recently talking about how Wyoming aged faster between July 2016 and July 2017 than any other state in the union, and that we now have a median age of 37.7 in Wyoming. And that's true, but Wyoming is still the 16th youngest state. Wyoming's population, Wyoming's workforce is getting older, but so is the US population. Wyoming still has a lower share of the over 65 population than the national average, and a lower share of the over 65 population than most surrounding states. So, again, context is important. Thoughts on this? Anyone who works in long term care, residential care, assisted living, want to comment on if they've seen their their employment change during downturns or their patient census change during downturns. Maybe if anybody's here on a hospital or in public admin, like maybe we can talk about that. As I said, in public administration, there's been a 40% decline in the number of people working in public administration as a CNA since 2002. I think a lot of that has to do with, possibly Wyoming making cutbacks in government, offering people early retirement, defunding public health programs. Those are just hypotheses I have regarding of, reasons why that may have happened. I don't know for sure yet why there would be a 40% reduction in CNAs in public health, but if anybody wants to comment on this graph, we can always come back to it. So even with the context that Wyoming is not really aging faster, that Wyoming did have a big bump in median age, but as a whole is not really aging faster than the U.S. population. So even with that context, there is no denying that Wyoming population has decreased and affected patient census. Many people have gone to Idaho, Utah, and Colorado, especially families. In those states, the number and percent of preschool-aged children has increased. This is in sharp contrast to Wyoming overall, which has seen a statewide decline of 7.8% in preschool-aged children since the 2010 census. Uinta County, close to all three of those growing states, ties Campbell County for the highest percentage of preschoolers in Wyoming at 7.6% of their population. And Uinta County, it seems, has really experienced large demographic shifts in recent years. Darla says the war on coal resulted in less scheduled surveys and ER visits in our area. The war on coal resulted in less scheduled surgeries and ER visits in our area. Yeah, I think Darla, there was definite declines in the number of people working in Campbell County over the last few years. I think notable dates where large numbers of people were laid off, and if you could schedule a surgery close to where your new employment is, like that would definitely change that. And the number of ER visits was definitely down. Yeah, as people leave, their families leave with them, and that has large implications for our economies, our schools, our healthcare as a whole, our patient census. Thank you for sharing that. So, regardless, though, of potential declines in patient census because of fewer people in the labor force, our projections still show 745 job openings for nursing assistants between the second quarter of 2017 and the second quarter of 2019. Far and away, there will be more openings for nursing assistants than any other healthcare practitioner or healthcare support occupation in Wyoming, which makes hiring for this occupation very time consuming. Over 90% of these 745 openings won't come because the field is growing so fast, but because the people working as nursing assistants will either discontinue their jobs as nursing assistants or they will leave the labor force altogether. While the rate of job openings for nursing assistants is not meaningfully different than the rate of job openings projected for all occupations, nursing assistants do tend to leave the labor force slightly more often than average. And for this, I think it's important to consider the demographics of nursing assistants and often their unpaid caregiving responsibilities. Many people did not find, I found 745 just to be an enormous amount of openings for nursing assistants, but yesterday many people working in the field found 745 to be just absolutely expected. So if you have an opinion on 745, do tell. We are nearing the end of our presentation. We're going to review some stuff, and then we will continue our discussion. So we've covered a lot of information. These are the important things that I think you should remember. But first, the Occupational Employment Statistics Program. It's a good resource with an enormous amount of information. And I will send everybody the links to the OES databases after we're done here. When I look at OES data, I personally tend to favor median hourly wages to average annual wages. For nursing assistants in Wyoming, median hourly wages are higher than most surrounding states and higher than 2/3 of other states around the country. Median hourly wages in Wyoming have gone up about 50% since 2004 compared to 30% nationwide. Within Wyoming, median annual wages are lowest in outpatient care and residential care and highest in public health. Earnings tend to depend on experience and the specific healthcare industry in which the CNA works. Nursing assistants are injured at more than 3 times the rate of non-fatal injuries for all occupations. Healthcare and social assistance employers tend to be less likely than average to offer health insurance. Health employment overall depends on patient census, which depends on population, which depends on employment, which depends on economic growth. Regardless, there will still be more job openings for nursing assistants than any other healthcare occupation. Yvonne says that when compared with other job openings in healthcare, I think it is high. Yvonne, if you would, please share what other job openings that you have observed that you think are recruited often. Possibly nurses, I think, seem to be a lot, sometimes orderlies and other healthcare support occupations. But as I said, I don't work in healthcare and I have a big blind spot for that information. So here I have included all of my sources. There are many different hyperlinks within this. I will I will include this both in the email and you will be able to go through the slides after this presentation and click on this information. So if you have anything to add, now is the time. If you haven't shared, I would love to hear what you have to contribute. There's this call is smaller than yesterday, but we still have HR managers, instructors, workforce specialists, and if there's a good time to share, it's now. So.
Caitlin, this is Gwen Young from Torrington.
Thanks, Gwen. Hi.
I just found it a little bit surprising that the wage was $14.92 because I know here it is not close to that at all. And a lot of the CNAs are only starting out at like $10.08. And a lot of them that have been working for quite some time don't make much more than 13 or 14. And we, like the injuries and stuff for us seems to be high, but I think it's because of a shortage of CNAs and they don't have enough help. So therefore, they're higher risk to have an injury.
Yeah.
And we just find all the time CNAs leaving. It's a huge revolving door because of injuries, because of wages. They can go to McDonald's and a lot of other places and actually start out with better benefits and don't get hurt. And so that's kind of a lot of the complaints or things they talk about here. But I think nurse-patient ratio is way, way down and they're having to work harder. I know there's many times here that in the facility here that there will be one CNA for 28 people with fairly high acuity with a lot of lifts and things like that. So I think, that's kind of where we're seeing it. We teach a lot of them, but when they go to work, it's, not enough money to hardly live, and they can go somewhere else and make more with less risk.
Gwen, I think you're totally right about not being able to make enough money to live, and sometimes it's a matter of, with their unpaid caregiving responsibilities, of sometimes it's a matter of being able to afford to work. If you can afford to pay for childcare and
Mhm.
then work, and then of course the cost of being away from your children. So you mentioned that you thought the median hourly wages were too high. It's hard for me to um, like, I think the survey is good, but I also think, that's overall. So that includes like people working in public health who have more reliable hours, who have better benefits, who, probably, work 40 hours a week as opposed to maybe like 36, like 3 12-hour shifts. If you don't like the median hourly wages, try checking out the median annual wages, because that's a different metric. And if those compare, like based on your region, if those compare, like check that out and let me know, you know, do those annual wages look plausible for someone in your area? And you also suggested the patient ratio being really high. Yeah, I heard someone tell me that it was someone they were CNA and they had one nurse on staff, and it was one one nurse and one CNA for 40 patients, which just seemed huge. The injuries are of course really high, and yeah, we see a lot of people like now that um, Target has committed to raising their starting wage to $15 an hour by 2020. I think you will see increased competition from retail and from restaurants. And as I said, like benefits are, retail employers are more likely to offer benefits than healthcare and social assistance employers. So I really appreciate your input. Janet said that I would be curious about the number, about how the numbers would change if home health CNA numbers were included. A newly licensed WIOA participant, that's the Workforce Investment Reinvestment Act. I can't remember the entire acronym for that, but a newly licensed WIOA participant was hired as a home health provider in Rock Springs at 15-14 an hour for 22 to 25 hours per week. But I expect her risk factors are high since she works alone and wouldn't be exposed to animals as well. And Janet, yeah, as I said, they've just started. This year is the 2017. The most recent information is the first year in which you can find information about home health care, about CNAs who work, about nursing assistants, excuse me, who work in home health care. But again, to find that information for Wyoming would be quite a bit more difficult. You could find it at the national level, but in Wyoming, again, those pools are just too small to be able to make good judgments. I would be curious if that WIOA participant earning 15-14 an hour for 22 to 25 hours per week, what if she has any benefits or if he has any benefits. I would guess not, but again, oftentimes CNAs are not offered benefits. So Darla, thanks for your compliment. I'm glad I could offer this information to you. Jenny says, I bet there isn't an in-depth training for CNAs on how to protect yourself from injury. Jenny, that is totally a blind spot for me. I have no idea if anybody else knows of one. From a data perspective, it looks like that would be a really, really good thing to continue to reinforce protecting yourself from injury for CNAs. Yvonne says, I manage an employment support program. CNAs have a hard time finding employment in Casper. Sam Case, she's a business representative from Climb, Wyoming, was on the call yesterday. They're graduating a crop of 10 CNAs in just a couple weeks, and they are trying to find placement for all of them. You also said that you see a fairly high turnover for CNAs. Additionally, some of your clients continue on into nursing. When I was those turnover graphs, they only include people who just have a CNA license. So they were taken out of the data set as soon as they got another license. So maybe if they got an LPN or an RN license, they were taken out of the CNA data set. So the data on turnover is only about CNAs. I've heard mixed reactions to that. Like some people say almost no one from who gets a CNA license goes on in nursing. I don't know if they develop a distaste for it, or they are just so disillusioned it's not what they thought they would. So yeah, some people definitely do continue on, and a lot of people recommend it. But a lot of CNAs are already in nursing school, and it's just one of the first steps. So let me know what you think about that, Yvonne. Maybe I'm totally off base. Um, Darla says that I agree with Gwen, and I think that the patient to CNA ratio does affect job satisfaction and possibly injury occurrence. There was someone on the call yesterday, worked at a assisted living or long-term care facility, and their CNAs, they had much lower CNA turnover than they had um, licensed practical nursing turnover. And they think it was because the LPNs work. They hypothesized that it was because the LPNs work 12-hour shifts and the CNAs worked 8-hour shifts, and therefore felt their time was more manageable, perhaps. I don't know. I don't work in healthcare. I would be interested to hear your opinion on that. Janet says the new CNA has PTO, paid holidays, but no health insurance. That's the newly licensed home health care CNA in Rock Springs, making 14 an hour, 15.40 an hour for 22 to 25 hours a week, paid holidays and PTO, but no health insurance. Yeah, health insurance is expensive, and maybe that's why healthcare employers aren't offering it as much as retail employers. It's very interesting. So well, we can continue this discussion, but I'm going to put my contact information up here just in case anybody else wants to reach out. Jenny, you said I should do more of these trainings. Do you mean more of this exact training again, or do you mean on a different topic? This is our third webinar overall, our third topic. The first one was myths of the unemployment rate, where we talked about how different people misconstrue the unemployment rate. And 2 months ago, we did the trends in the transportation warehousing industry, and specifically talked about people getting a commercial driver's license certification. So I'll be interested to hear. Do you mean more on healthcare specifically, more on CNAs? But either way, I appreciate it. It's nice to hear positive feedback. So thank you. Oh, sorry. I just noticed this. Janet said that some of our younger CNAs go on to nursing school, but it's not typical. A lot of our CNAs trained through government funding, through WIOA training, are single older moms or 30-ish moms. Yeah, I think the 30-ish lines up with the median age that we found. It's it's yeah, it's a lot of single older moms, and that presents being a single mom and working as a CNA presents a lot of barriers, because you have to be able to get enough money to work to afford childcare, and it's sometimes it's a matter of like, can I even afford to work, which I think is a heartbreaking decision that many people that is a reality for many people. Gwen, you said that you think the annual wage is higher because a lot of CNAs work overtime to make up for the low wages. Yeah, that could definitely be it. Or they may work overtime because there's just so few CNAs. Yeah, and that they're obligated to take that overtime because of the low wages, and therefore risk much higher injury because they are tired. There's just so much that goes into a systemic problem of not having enough CNAs. Callie, I'm glad you found the information was very good. yeah, I'm bummed you couldn't meet us at the start. We will have this is all recording, and everybody will get an email right after I stop the recording to talk about, that'll just show the recording so you can watch whatever you missed. Hopefully the sound will be good. You said you also said Callie says we seem to have a lot of turnover and finding more CNAs to replace. Callie, where is it you work again? I can't remember. You work in assisted living, is that right? And yeah, in Cody. And there and as I said, like there will be more positions open for CNAs or for nursing assistants than um, almost any other healthcare occupation. So, um, and I just think that that must compound um, so much because that makes it recruiting for this particular job time consuming, difficult, exhausting, and frustrating sometime. And in Cody, Wyoming, you said there's not much of a job pool. I imagine that like the cost of living sometimes is not the cost of living in Jackson, but with summer and tourist season, that the cost of living could get quite high. And many people, maybe they decide to work outside, maybe they decide to rent a room outside Cody and rent out their places in the off, where they live normally. I don't know. Airbnb got really popular in Wyoming right after the eclipse. I noticed that you could not find an Airbnb in Wyoming. Maybe there was 3 places, and then after the eclipse, everyone was like, "Oh, Airbnb." So yeah, I think that can also contribute. So rural areas just have talking about healthcare in Wyoming is just such a complex issue because rural healthcare is a completely different animal than healthcare overall. And when people in Washington talk about healthcare, like they really have no idea what that means for rural Wyoming. That's my opinion. That is not a not a research and planning opinion. That's just my opinion from looking at the data. Like rural healthcare is a completely different animal. So we've gone well over our time, but I'm happy to continue this discussion. I'll continue the recording in case anybody has to leave and needs to, and doesn't want to miss the discussion. But yeah, I appreciate everybody's feedback. Jenny, you said that you would appreciate more of these trainings on different topics and different occupations. If there is something specific you want, like I would be happy to rustle up that information and do this again. So I'm definitely looking for new topics. I think I've exhausted my pool with the last 3 things that we've done um, on on transportation and warehousing and myths of the unemployment rate, and then nursing assistant. So thanks for joining us, Julie. I really appreciate it. I hope you all have a good afternoon, a good rest of your week, a safe 4th. And I'm glad you all could join us. Thank you so much. Thank you. Janet, Jenny, did you guys have any other questions, any other thoughts? Any other things that looked totally off in this presentation? We can go back to any of the slides. Okay, well, I'm going to stop the recording. Janet, you said it's very interesting. Thank you so much for this presentation. Thank you for joining us. If you have suggestions for future things or anything else you'd like to know, do contact us. So thank you so much.